Let's see an NCLEX RN video based on care for patients with sexually transmitted infection. What is the most effective screening tool for cervical cancer? DNA testing, papillary test, ultrasound, X-ray. So pap smear or papillary test is the most effective screening tool for cervical cancer. Ultrasound, X-rays and DNA testing do not screen for cervical cancer. What are the symptoms of secondary syphilis? Maculopapular rash, canker, alopecia, decreased mental function, joint pain. Secondary syphilis symptoms include a maculopapular rash that may develop on the palms, soles, buttocks and upper thighs. Other symptoms may include fever, malaise, alopecia, joint pain and headaches. Canker is not a sign of secondary syphilis, it is a sign of primary syphilis. Neurosyphilis may result in decreased mental functioning. So here the symptoms of secondary syphilis are maculopapular rash, alopecia and joint pain. What is a key point the nurse must make to patients who are diagnosed with genital herpes? Transmission of genital herpes is possible even when symptoms are not evident. Transmission of genital herpes is possible only during symptomatic episodes. Transmission of genital herpes is not possible when the patient is taking the prescribed medications. Transmission of genital herpes is possible only during the first outbreak. Transmission of genital herpes is possible even if taking medications to treat the herpes and when asymptomatic, not just during the first outbreak or symptomatic episodes. So here the answer is transmission of genital herpes is possible even when symptoms are not evident. Complications of gonorrhea can lead to which clinical manifestations? Maculopapular rash, ectopic pregnancy, infertility, pelvic inflammatory disease or PID, urinary incontinence. Complications of gonorrhea include pelvic inflammatory disease, which can cause ectopic pregnancy and infertility. So ectopic pregnancy, infertility and pelvic inflammatory disease. Pelvic inflammatory disease can cause an abscess or scar the fallopian tubes, which may block the fertilization or interrupt the progression of an egg and lead to which condition? Ovarian torsion, ovarian cyst, ectopic pregnancy, fallopian cancer. Ectopic pregnancy. Scarring of a fallopian tube may cause a fertilized egg to implant in fallopian tube anywhere outside the womb. Ovarian torsion or twisting of the ovary, ovarian cyst or fallopian cancer are not the result of pelvic abscess or scarring of fallopian tubes. The nurse recognizes that the virus responsible for cervical cancer is called cytomegalovirus, herpes simplex virus, human parvovirus and human papillomavirus. So the virus is human papillomavirus or HPV. The nurse understands which of the following are correct about syphilis. A canker is a common symptom in tertiary syphilis. Neurosyphilis invades the CNS and may occur at any stage of syphilis. The most infectious stage of syphilis are the primary and secondary stages. Latent infections are detected primarily by visual inspection. Penicillin G is the preferred treatment for all stages of syphilis. A canker is a common symptom in primary syphilis. Latent infections are detected by serology. So here the correct options are neurosyphilis invades the CNS and may occur at any stage of syphilis. The most infectious stage of syphilis are the primary and secondary stages. Penicillin G is the preferred treatment for all stages of syphilis. Which statement is correct when providing discharge instruction to a patient with genital herpes? Genital herpes is an infection that is always symptomatic. Genital herpes is a low contagious infection. Genital herpes is an infection that can be cured by antivirals. A person can transmit HSV or herpes simplex virus to others without displaying any symptoms. Genital herpes is an infection that can be asymptomatic. Genital herpes is a highly contagious infection. Genital herpes cannot be cured. And also one more point is condoms may not stop the transmission of herpes. Antivirals may lessen the symptoms, but they may not completely cure it. So here the correct answer is a person can transmit herpes simplex virus to others without displaying any symptoms. The nurse recognizes which patient is at greatest risk for chlamydia trachomatis. An 18-year-old single female, a 45-year-old married female, a 60-year-old single female, a 30-year-old married male. Single sexually active females and males under the age of 25 are at increased risk of chlamydia and gonorrhea more than other age groups. So here 18-year-old single female. The nurse recognizes which statements are true when discussing gonorrhea. Gonococci are viruses caused by Neisseria gonorrhea. Concomitant infection with chlamydia can occur, therefore test for both gonorrhea and chlamydia. Gonorrhea remains localized to an expectant mother, therefore there is very low risk for vertical transmission to the infant. The NAT or the nucleic acid amplification test is effective in detection of genitourinary infection of Neisseria gonorrhea. A hallmark symptom in males with gonorrhea is copious purulent urethral discharge. So here true statements you need to find out. Gonorrheal organisms are bacterial in nature and not virus. The risk of concomitant infection of gonorrhea and chlamydia is mostly common, nearly 50%. Infants exposed to cervical exudates at birth are therefore at higher risk for infection of being delivered vaginally to a mother who is diagnosed with untreated gonorrhea. NAT test or the nucleic acid amplification test has sensitivities to 99% and therefore is effective for detecting the infection. The hallmark sign of gonorrhea in males is gonococcal urethritis as evidenced by copious purulent urethral discharge. Statements are concomitant infection with chlamydia can occur, therefore test for both chlamydia and gonorrhea. The NAT or the nucleic acid amplification test is effective in detection of genitourinary infection of Neisseria gonorrhea, and hallmark symptom in males with gonorrhea is copious purulent urethral discharge. The nurse recognizes which of the following statements are true about pelvic inflammatory disease. Pelvic inflammatory disease is an acute infection that routinely descends from the upper genital tract to the cervix or vagina. If the patient is diagnosed with PID and is pregnant, inpatient admission should be considered. Symptoms such as lower abdominal pain and elevated BP are specific criteria for PID. Laparoscopy is the only definitive test to diagnose PID. Tubo-ovarian abscess is a severe complication of pelvic inflammatory disease. Pelvic inflammatory disease is an acute infection that ascends the upper genital tract. It does not descend. A provider will consider inpatient hospitalization with diagnosis of PID and pregnancy. Other situations or conditions that would warrant consideration are poor response or tolerance for oral antibiotics, HIV, differential diagnosis such as tubo-ovarian abscess, appendicitis or ectopic pregnancy. Elevated BP is not a specific criterion to pelvic inflammatory disease. Specific manifestations include lower abdominal pain, uterine tenderness, adnexal tenderness and cervical motion tenderness. Pelvic inflammatory disease can be detected by transvaginal ultrasound, MRI, endometrial biopsy and laparoscopy. These procedures are helpful in conjunction with clinical manifestations of pelvic inflammatory disease. Tubo-ovarian abscess with rupture can lead to peritonitis or sepsis and is considered a surgical emergency. So here the true statements are: if a patient is diagnosed with PID and is pregnant, inpatient admission should be considered, and tubo-ovarian abscess is a severe complication of pelvic inflammatory disease. Keisha, a 24-year female, presents to her OB/GYN healthcare provider for her checkup. Her medical history consists of sexual activity since 13 with a history of 11 partners. Chlamydia treated at a clinic 1 year ago, smoking 1/2 package a day and drinking every weekend while partying. She also states she does not use condoms. During her physical examination, Keisha complains of lower abdominal pain. On examination, the provider notes that Keisha has mucopurulent discharge coming from her cervix along with uterine tenderness. The provider sends NAT or nucleic acid amplification test cervical scabs for gonorrhea and chlamydia and performs a pap test and wet prep that immediately show the presence of WBC. Serology is sent for HIV, syphilis and hepatitis. As part of his workup, the provider sends Kesia for a transvaginal ultrasound. The provider diagnosed her with PID. She is given an IM shot of ceftriaxone and sent home with a prescription for oral doxycycline and metronidazole to be taken for 14 days. Keisha's nurse educates her about the medication and information on steps to make positive lifestyle changes related to drinking, smoking and healthy sexual practices. Keisha returns within 3 days. She states she is feeling much better, which is confirmed by a clinical examination. All results are negative except for chlamydia. Keisha is informed chlamydia can be treated with doxycycline. Keisha is interested in making some lifestyle changes because the diagnosis of PID has scared her. The nurse provides Keisha with community resources, the number to the local health department, and informative websites to assist her in making these healthy modifications. She is asked to return in 3 months to be retested for at-risk sexual transmitted infections. Keisha is diagnosed with chlamydia during her recent examination. The nurse is aware that this infection can transcend the upper genital tract and lead to which clinical manifestation if untreated: leg or calf tenderness, adnexal tenderness, pelvic tenderness, heavy menses, abdominal pain, fatigue, elevated C-reactive protein, positive rapid plasma reagent, elevated erythrocyte sedimentation rate, uterine tenderness, abdominal pain, cervical motion tenderness. So uterine tenderness, abdominal pain and cervical motion tenderness are all clinical manifestations of pelvic inflammatory disease. Chlamydia can be a causative pathogen of pelvic inflammatory disease. Keisha is diagnosed with pelvic inflammatory disease. If left untreated, which complication is she at risk for developing? Uterine prolapse, polycystic ovary syndrome, infertility, endometriosis. Pelvic inflammation can lead to scarring in the uterus, fallopian tubes and pelvic cavity. Scar tissue may block or interrupt the normal movement of eggs into the uterus and thus block the fertilization by sperm, thus resulting in infertility. Keisha is prescribed metronidazole or Flagyl as part of the medications she needs to take after discharge. When addressing this medication, what should the nurse explain? This medication should be taken only on an empty stomach. This medication should be refrigerated. When you take this medication, alcohol should be avoided. When you start feeling better, this medication can be discontinued. Consuming alcohol with metronidazole places the individual at risk for severe nausea and vomiting. So when you take this medication, alcohol should be avoided. That should be explained. The first option, the medication should be taken only on an empty stomach. That is incorrect. Metronidazole can be taken with food or milk to avoid stomach upset. The second option, if you see, metronidazole should be refrigerated. Metronidazole should be stored at room temperature and not in direct sunlight. So this is wrong. And the last option, it is incorrect. When you start feeling better, the medication can be discontinued. Not taking the entire prescribed medication regime may cause reinfection. The nurse provides recommendations for which healthy lifestyle changes for Kesha. Avoid sexual intercourse while under the influence of drugs or alcohol. Limit the number of sexual partners. Utilize condoms if engaging in sexual activity. Seek out a website to become properly informed about STIs. Abstain from sexual intercourse. All the above are healthy lifestyle changes. Abstinence is not necessary. Safe sex is. So here, avoid sexual intercourse while under the influence of drugs or alcohol. Limit the number of sexual partners. Utilize condoms if engaging in sexual activity. Seek out a website to obtain a properly informed about STIs. Which statement by Kesha indicates that teaching has been effective? I know I should eat well and limit sexual activity for a while. I can expect my symptoms to improve within 3 days. There is no point in telling my boyfriend I can't give him pelvic inflammatory disease. I should call my provider if I experience a fever, increased abdominal pain, vaginal discharge or nausea and vomiting. Because I was prescribed doxycycline, I know I should avoid prolonged exposure to sunlight. The nurse should explain that the patient should be on pelvic rest, no intercourse or sports activities for at least 2 weeks while on treatment. Patient should demonstrate clinical improvement within 3 days after the initiation of therapy. Sex partners should be aware of the risk of exposure to an STI. Increased abdominal pain, vaginal discharge or nausea and vomiting may indicate that prescribed medication is not effective. Doxycycline can cause photosensitivity, so it make the skin sensitive to sunlight. So the correct options in teaching are: I know I should eat well and limit the sexual activity for a while. I can expect my symptoms to improve within 3 days. I should call my provider if I experience a fever, increased abdominal pain, vaginal discharge or nausea and vomiting. Because I was prescribed doxycycline, I know I should avoid prolonged exposure to sunlight. Hope you understood this video. Thank you so much. Please do keep watching for more videos.